Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the measurement of the solute concentrations, one important thing is plasma osmolarity. Okay, what is plasma osmolarity? Plasma osmolarity, the normal plasma osmolarity is around 290 milliosmoles per liter is the normal osmolarity. But if we have to take up a range, it is 280 to 290 milliosmoles per liter is the range of the plasma osmolarity. So out of this around 290 milliosmoles, sodium and associated ions will constitute around the 270 milliosmoles. So sodium ions and the constitutive ion associated ions will constitute around 270 milliosmoles, whereas urea constitutes around 5 milliosmoles is urea. Then next important is glucose. Glucose also constitutes around 5 milliosmoles is also glucose. So glucose also constitutes around 5 milliosmoles. Then we have next one more, we have plasma proteins. Plasma proteins constitute around less than 2 milliosmoles is the plasma proteins. Then we have finally remaining ions will constitute around 8 milliosmoles. The remaining ions will constitute around 8 milliosmoles. So this is the measurement of the plasma solute concentration. In them, most important is plasma osmolarity.
thank you and thank you for watching.